Dear friends, happy morning to all. Today, let us discuss about vitamin D deficiency. I am yours, Big Boss, Nadippu Arakkan, Watermelon Stock, Dr.T.Diwagar, B.P.T, physiotherapist. Okay, actually, I noticed lots of people are having, lots of patients are having vitamin D deficiency. Okay, why it will occur? Actually, it's a very good topic and let us use it. Lots of people are having cough muscle. Lots of people are having back pain without a disc prolapse, without a disc bulge. Why it will happen? Actually, 5 days before, one patient came to my clinic and he explained his problem. He is having back pain, but his MRI normal, his CT scan normal, everything normal. Okay, why that patient muscles are so strengthened? He is not having any muscle weakness. Then I suggested to blood test of vitamin D. So, what is the normal level of the vitamin D? Actually, why the vitamin D deficiency it will occur? Because due to the lack of sunlight exposure. Nowadays, actually, the most of the patients in USA they are having vitamin D deficiency because there is a lack of the sunlight exposure. But here, nowadays in our Indian country also, lots of people are having vitamin D deficiency. I don't know why. Because actually there is a no food for compensate the vitamin D deficiency. There is no food. Actually, the orthopedicians, they are orthopedic surgeons. They are suggesting vitamin D powder and vitamin D tablet. But my point of view, not only my point of view, the sunlight exposure, especially the 9 o'clock to 12 o'clock, the sunlight. That sunlight only it will give vitamin D to your body. Okay. Then, so what is the normal level of the vitamin D? Actually, what is the deficiency? Below 10 ng slash nanometer milliliter. Okay, that means below 10 ng slash ml. Okay, actually below 10 nanogram. Sorry, it's not a nanometer. Below 10 nanogram slash milliliter, that is the deficiency of the vitamin D in blood test. In the blood test. Okay, then what is the insufficient level? Actually, 20 to 29. That is the insufficient. 20 to 29 nanogram slash milliliter. That is the point. That is the insufficiency of the vitamin D in your blood test, in your blood. Okay, what is the normal level? Actually, 30 to 50 nanogram slash milliliter. That is the optimal level, normal level of the. Again, I said 30 nanogram milliliter is the normal. 30 nanogram milliliter is the normal. Okay, 30 to 50. Again, I said normal level of the vitamin D. 30 to 50 nanogram millimeter is the normal. 20 to 29 is the insufficiency. Okay, below 10 is totally deficient of the vitamin D. Okay, so if you are having any pain in the cough muscle without disc bulge, without any reasons of back pain, immediately you consult with the physiotherapist, take blood test, and then go to the orthopedic surgeon and get a prescription from orthopedic surgeons. Because physiotherapists, we are not prescribing drugs. You go to, but we are suggesting, we are given the home advice. You should take sunlight exposure from 9 o'clock to 12 o'clock. Again, I said below 8 o'clock, below 9 o'clock sunlight, it is not useful for you. The sunlight, the morning 9 o'clock to 12 o'clock sunlight is very essential of exposure of the vitamin D. Then again I say it. Again I want to say something. You should take vitamin D powder per week, or depends upon the orthopedic surgeon prescription. Then you should take regular vitamin D. At least go to your house terrace and take 10 minutes of vitamin D in open sunlight, because there is the no food for common sense. Vitamin D, it's a very important factor. Take milk, take oral milk, and then vitamin D, it is helpful for calcium deposition to bones and muscles. It's a very essential. It's a very essential factor. It's a very essential nutrition of vitamin D. So again I said, actually the calcium, it will deposit to your bones and muscles by synthesis of vitamin D. Okay, if lack of vitamin D, now automatically you will get calcium deficiency. So each and everyone be careful. This video for North Indian physiotherapists and North Indian medical professionals and North Indian general public. Thank you so much. Bye bye.